Hello everyone, I am Dr. Kelechi Eguzo from Marjorie Bash Foundation. Today I'll be leading you in a discussion around cervical cancer and human papillomavirus or HPV. What you need to know. This is part of our project called I Can Conquer Cervical Cancer. And today we'll be discussing what the service is, if the cancer is real, what causes the problem, and why HPV is important. And after that, we will go on to discuss how cervical cancer manifests and what you can do to prevent it. This project is brought to you proudly by our Cancer Control Consortium in southern Nigeria. This is largely, the members of this consortium include Breast Without Spots in Enugu, Man Project Foundation in Port Harcourt, Stand Up to Cancer Foundation in Abuja, Health Development Initiative in Aba, Nigeria, Initiative for Public Health Advancement and Research in Umuahia, and of course, Marjorie Bash Foundation. Like I mentioned, this is part of the I Can Conquer Cervical Cancer project. So, let's dive in. What is the cervix, you may ask? The cervix is just the lower part of the womb. So you see, this is the woman's womb, and the lower part here is the cervix. And it connects the vagina to the womb, which is the uterus. It's about 6 centimeters long, from you can see this part here. And during childbirth, the cervix is the part that we medical people will say, oh, the door is open or the way is open to allow the baby to pass through. So it's a very important part of the female reproductive system. So cervical cancer, you may ask, is what actually is that? Cervical cancer is an abnormal growth of the cervix. So in this image, you can see that this is a normal part of the cervix and this is an abnormal part. So this is growing bigger. This is just growing bigger out of control. That is what the cancer actually is. And cervical cancer would extend from the cervix around here into the vagina or even into part of the uterus or other parts of the body around it. Cervical cancer is a problem in Nigeria, and not just Nigeria, but other parts of the world. This is the second most common cancer affecting Nigerian women. The problem actually is not that it just affects women, but it is something that kills them when they are very young, when they are beginning to settle in life, and after having children, they want to start raising their children, and boom, the cancer just takes them away like that. Most people in Nigeria find out about this disease when it is very late and it's advanced. But the good thing is that we can prevent cervical cancer if we detect it early. And when we find the disease early, we can cure it even in Nigeria. So it's important, very, very important, that you pay attention to this presentation so you can understand what you need to do. So let me ask you a question, okay? Just out of curiosity. What do you think mostly causes cervical cancer? Is it A, witches and wizards? Maybe B, HPV virus? Or C, bad luck? Or maybe you don't know. What do you think the answer is? Okay, so if you said B, HPV virus, you are correct. The human papillomavirus or HPV is common in women and men, not just women, no, seriously. And there are about 200 different types of this virus. So you can imagine HIV virus, which causes AIDS. It has only two types, but HPV has 200 different types, and it is sexually transmitted, meaning people get it largely due to sexual intercourse. It could be oral sex or whichever kind of sex that happens. HPV is spread from person to person. So you don't have animals, excuse me, like mosquitoes giving HPV. No, it doesn't happen that way. It is from man to woman or from woman to man. So it's important that we talk about HPV, especially now that We've just finished the International HPV Awareness Day on March the 4th. And the theme for this year's Eve campaign was Give Love, Not HPV. The reason we are bringing you this talk is to strengthen that message about giving love and not HPV. So let's find out how we can do this. Pay attention to this video.
Love comes in all forms. Family love, love between friends, and romantic love. And regardless of who we love, one thing remains the same. We need to protect the ones we love, which is why we need to give love, not HPV. HPV, or the human papillomavirus, is one of the most widespread sexually transmitted viruses in the world. Over 80% of people will be infected by HPV at some point in their lifetime. While some types of HPV don't have visible signs, they may still cause deadly cancers. No one should lose someone they love to a cancer that was caused by HPV.
So, that video finished by saying no one should lose someone they love to a cancer that is caused by HPV. Do you know that it is not just cervical cancer that is caused by HPV? In this slide, it shows you the number of cancers that are caused worldwide by HPV. And this was back in 2006. Cervical cancer is the most common cancer, meaning 100% all of cervical cancer that was caused in that year was attributed to HPV. But it also causes cancers in the oropharynx or the oral cavity. So around here, you see these parts of the mouth, everywhere in the mouth, HPV can cause cancer. It also causes cancers in the anus, even in the vagina and on the penis. So HPV is not just a problem for women. It affects men as well. I have to stress that because it's important that everybody takes action against HPV. So there are other things that HPV causes, and we call them genital warts. So these are just kind of small, soft growths on either the penis or the female reproductive system. So you can see it here on the man, and it can also appear in the woman. And you may ask, how does cervical cancer develop from HPV? So here's how it happens. First, someone gets an infection, and over time, the body clears that infection. So the HPV comes, attacks the body, and then the body clears it again, and somehow the person might get the infection again. So it's possible that over time you might get reinfected several times. And the body tries to clear this. But after some time, due to some factors we'll discuss later, the body is unable to clear the HPV infection. And so it causes more damage to the body. And over time, like up to several years or even up to 20 years, it might take the body that time to develop from just an infection from HPV up to cervical cancer. So it's important that we bear this in mind, that someone can get reinfected. And even when someone has the infection, they can also transmit it to another person without knowing it if you don't take action. So when someone has cervical cancer, what does it look like, you may ask? Unfortunately, early cervical cancer has no symptoms. You don't know. You don't even get to feel it. But commonly, when it becomes a little bit advanced, the woman might have abnormal vaginal bleeding. We all understand that women kind of see their menses at some interval. But when someone has cervical cancer, they might have bleeding in between periods or with sexual intercourse, or even after they have stopped seeing their menses completely. That's during menopause. Also, it might cause abnormal vaginal discharge. And then when the disease has progressed and has kind of affected other parts of the body, you might have leg pain or leg swelling, pain in the pelvis, so like in the waist. And sometimes if it affects the bladder, it might cause changes to how the person urinates or even seeing blood from this from the bladder when they're peeing, or from the rectum when they are going to toilet. Then it also causes weight loss. This picture here kind of summarizes what some of the symptoms of cervical cancer. But then I want to emphasize that when someone has any of these symptoms, it does not mean they have cervical cancer, because other diseases can also cause some of these symptoms. It's important that a woman who is having some abnormal bleeding from the vagina, or when they are seeing bleeding after sexual intercourse, they should see a doctor or a nurse as soon as possible to check out what's going on. Okay, so I'm going to ask you another question. Okay, are you all ready? So, which of these do you think makes someone likely to develop cervical cancer? Is it when they smoke? Maybe when they have multiple sexual partners? Having other sexually transmitted infections like chlamydia? Or all of these things? Or maybe you don't know. Okay, so if you say D, all of the above, you are correct. The risk factors for cervical cancer are: one, infection with HPV. We've talked about HPV before. It's very important, the most important thing that can make someone have cervical cancer. The other things that can make someone develop cervical cancer is not going for screening regularly, and we'll talk about that screening down the road. Then, when someone has some other sicknesses that could weaken the immune system, like HIV infection, they also make someone likely to have cervical cancer. Smoking cigarettes is known to cause cervical to link to help to make someone more likely to have cervical cancer. Also, being sexually active when you're very young, or having multiple sexual partners throughout your lifetime, not just now. So let's say if you've had 10 partners in the past and you're only having one right now, that also increases your chances of having cervical cancer. Then if you have other sexually transmitted infections like chlamydia. So how can we prevent this disease? Remember, we've talked about what cervical cancer is, how it presents, and what's the role of HPV infection. So you were asking ourselves today, what can I do to prevent this problem? The first thing we can do is to make sure that we don't have HPV infection. I'm sure you agree, right? So imagine this: if I told you that mosquitoes would cause malaria, the first thing you want to do is to make sure you don't get mosquito bites, right? Good. So similarly, in cervical cancer, the first thing you want to do is to make sure you don't get the HPV infection, and this is done through vaccination. So vaccination, which is like giving a vaccine, just like measles vaccine or any of those other vaccines we give to children. When you give this to young people between the ages of 11 and 26, you can prevent them from having the HPV infection. Usually, it requires this vaccination requires about 2 to 3 doses, and this depends on what vaccine you are using and on the age of the person as well. So, given the fact that we want to do this when girls are around 11 years, 26 years, or boys between 13 and 21 years, you can see it makes sense to give this vaccination in schools, in secondary schools, right? Good. So we advocate that every child should get this vaccination. And of course, when someone gets this vaccine, they might get a small reaction like a fever. But this vaccine, HPV vaccine, it is very, very safe. And it's available in Nigeria, but you have to pay for it, unlike childhood immunizations. Okay, let's move on. So how do you prevent this disease? The next thing you can do is what we call ABC. Can you all say it after me? ABC. So the ABC of prevention is one, abstaining from sexual intercourse until you're married. And I'm sure you can all understand this because HPV is transmitted largely through sexual intercourse. So no intercourse, no HPV, right? And then if you are all if you want to start having sexual intercourse, wait until you're older. I'm saying this specifically to young girls in high schools because it's possible that one could start experimenting with sexual intercourse when they are very young. But when you start having sex when you're younger, you also get exposed to HPV over a long time, and that's like we saw in the previous slides, can make you have cervical cancer. Correct. And then, if you are having sexual intercourse, be faithful to one partner. and reduce the number of partners you have over your life. So I'm saying this because because having multiple sexual partners we saw is one of the things that leads to cervical cancer. And thirdly, we want to use condom, and use condom consistently every time. Use it correctly, and then we should not share needles if you are doing drugs, and don't even start doing drugs at all. Okay? Then early education and early detection are also important. We'll go into that right now. So early detection, screening. That's the other thing we can do to prevent cervical cancer. This helps detect the disease when it is very small. And then examples are visual inspection with acetic acid or Lugol's iodine. These things are done locally, where a nurse or a doctor can just look in the cervix, paint it with a little chemical, and see there's a reaction to show that there could be early cervical cancer. This is very, very important that every woman gets to do this at some point in their life. The other way we can also prevent, kind of screen for the disease or detect it early, is using HPV testing. Here, a small sample is taken from the cervix and checked to see if there's the DNA of the human papillomavirus. That's a big word. But it's also available in Nigeria. We can also do pap smear in Nigeria, where in the pap smear, the doctor or the nurse looks in the cervix, takes a little bit of a sample, puts it in a microscope slide, and to see if there is evidence of cancer in it. So most screening in Nigeria starts when you're about 30 years old, and we recommend that you kind of do this every 3 years just to see how things are going. Do you think you can do this? I think you can too. So the other way you can prevent cervical cancer is by stopping smoking. Do not smoke cigarettes. And I say this with all emphasis. Don't. If you're already smoking, stop smoking. Smoking causes many cancers and the other diseases in the body, like heart disease. Smoking also reduces your body's ability to fight infections. And you know what? It does not add anything to your life. Nothing. No. So, let's go back again to talk about HPV and what you can do. This is talking about giving love.
If we work together, we can ensure all of our loved ones are protected from HPV. When you educate yourself, you give love, not HPV. When you teach someone, you give love, not HPV. When you seek early detection, treatment, and vaccination, you give love, not HPV. Join us in making the world a safer place. Let's give love, not HPV.
Okay, that video was contributed by International Papillomavirus Society to emphasize how we can give love and not HPV. And let's go over what that video said. The first thing you can do is education. You can educate yourself to understand about HPV, which is what you're doing by watching this video. And you can also educate other people by sharing what you've learned in this video and in our presentation with them. Then we have to educate our healthcare providers about HPV and the need for them to be able to know how to detect cancer early. You should also educate your community members and your family and friends. The other thing you can do to prevent cervical cancer is to ban cigarettes in your community. This could be your school, this can be your bank, this can be anywhere where you work. Let's make our schools and our communities safe by reducing smoking. We can do that. Yes, you can. And then encourage your local leaders to develop a cancer policy. Let's get our community leaders. From the community leader to the local government authorities to the state government. Let's raise awareness about cervical cancer. Let us promote vaccination and early detection, treatment, and more importantly, let us invest our time and resources in research to understand how we can further reduce cervical cancer in our communities. Spread this message. And if you want to know more about what's going on regarding cervical cancer around you, you can like my Yoruba Foundation page on Facebook. So, before I go, let me ask you again to make sure you're following me. How can we prevent cervical cancer? I have a list of options. A, stop smoking. B, abstinence, being faithful and using condom. C, regular screening if you're within the recommended age. D, HPV prevention or vaccination. E, all of the above. F, I don't know. Which one do you think is the answer? Okay, so if you said E, all of the above, you're correct. If we do all of these things, we can prevent cervical cancer in our communities. And so to summarize, let's just bring all these things back together. Let's listen to this important video from Emblem Health.
Cervical cancer is a frequently occurring cancer in women and one of the most preventable. To reduce your risk of cervical cancer, see your doctor to get a pap smear and HPV screening on a routine basis. Quit smoking, and if you are sexually active, use a condom and limit the number of sexual partners. If you are between the ages of 11 and 26, talk to your doctor about the HPV vaccine to prevent the virus that can lead to cervical cancer. Cervical cancer, know the facts.
So thank you very much for listening to us today. The leaders of this project include Dr. Kelechi Eguzo, Prof. Ifomo Okoye, Lady Flores Mbogo, Dr. Chukwuemeka Oluoha, Mr. Emmanuel Loic Ekong, and Mr. Mayor Oparume. If you have any questions, this is the time for you to ask. And we're very grateful to our sponsors, Nigerian Christian Hospital in Aba, Nigeria. This is a cancer treatment center. Go check them out if you have any questions. And of course, International Papillomavirus Society and other sponsors that are too numerous to mention. Thank you very much for paying attention.